Hi, I'm Dr. Michael Gruttadauria, and I'm a board-certified chiropractic neurologist in Huntington, New York. And today's presentation is on post-concussive syndrome, otherwise known as persistent concussion symptoms. So everybody knows what a concussion is. Head trauma, brain injury, traumatic brain injury, mild traumatic brain injury. But I really want to be clear that I do not treat acute concussion. Acute concussion, injury on the field, motor vehicle accident, all of these things need to be evaluated medically by a neurologist in the hospital, emergency services. So what we're really going to be talking about is what happens weeks and months after a concussion. So a concussion happens in a couple of different ways. So the head can strike a stationary object. So let's say you fall and you hit your head on the ground, or an object, or during an auto accident, you bang your head on the windshield. An object hits the head, such as a ball or a stick during a sports game, or the result of a collision with, two players. Very common in fact, in soccer, where, you're constantly hitting the ball. Very commonly, like multiple small, hits to the head with a ball can actually initiate a concussion. Or a quick acceleration, deceleration of the head with no contact, which is like a whiplash injury. And this commonly happens in car accidents, but also in dancers and gymnasts due to the rapid movement. So TBIs, or traumatic brain injuries, are caused by a whole bunch of different things. Falls, very commonly, sports and other things, assaults, motor vehicle accidents. But about 75% of all traumatic brain injuries every year are considered concussions, the mild traumatic brain injury. So one of the big questions when I ask people if they've ever had a concussion is they say no immediately, and then it's followed by, I didn't go to the hospital, or I wasn't knocked out. So that's really a misunderstanding, because you don't have to be knocked unconscious for something to be a concussion. In fact, mild concussions can cause very severe symptoms, and very more significant injuries to the head may cause no symptoms. So it's not really like the degree of injury that causes the problems later on. So, a trauma-induced alteration in mental status that may or may not involve loss of consciousness, that's the definition. And, about 300,000 sports-related concussions happen every year. And a lot of times we're just, hoping that nothing's going on, and, a kid gets hurt on the field, and, they pop right back up, and we're like, oh, thank goodness, nothing happened to him. But we have to really be aware of what's actually going on in the brain when this trauma happens. So 4 big things happen during and after a concussion. So we have an injury to the cerebral cortex, which is the big part of the brain. That's usually what we think of when we think of the brain, is the cerebral cortex. So you have the brain bouncing around inside the skull. The inside of the skull has a lot of, sharp, jagged edges. And you can have an injury, direct injury to the cortex. So what that does is it activates the microglial system. The brain has its own internal immune system called the microglial system. And these support cells, microglial cells, can activate an inflammatory response, and that initiates healing. An injury to the brainstem. So this is very, very common. In fact, this happens in almost all cases of concussion, because you have a moment of rotation when the head hits. So the head might be twisted, or in a rapid movement fashion, and you get a traction of the brainstem, which is the area that connects the brain to the spinal cord. And so what happens here is you have changes in brainstem function. So this commonly results in balance issues, like we call it vestibular dysfunction, or BPPV, which is benign paroxysmal positional vertigo, where you have like the room is spinning or you're spinning. You get a disconnection of the VOR. So the VOR is the vestibulo-ocular reflex. I'll say more about that later on, but basically the head and the eyes move in a very coordinated fashion. In order for me to continue to look at my screen, I need to be able to lock on that screen. We call that gaze stability, my ability to set my gaze. And I'm looking at the screen, but I can move my head anywhere I want. And it looks like my eyes stay locked on the screen and my head moves. But really what's happening is, as I move my head, my eyes move in an equal and opposite direction and speed. And that is calibrated through something called the VOR, or the vestibulo-ocular reflex. When you have a head injury, that becomes disconnected. And now eye movements become abnormal. And that really says a lot about what the problems down the road may be. And I'm going to say more about that. Another thing that happens because of the autonomic nervous system living in the brainstem and an injury to the brainstem is something called dysautonomia. So this is palpitations or lightheadedness, or when you go from a seated to standing position, you feel like you're going to faint. All these different kinds of issues are called dysautonomias, and this is very common secondary to concussion. We get something called altered blood-brain barrier integrity. So we have a protective coating around the brain that kind of keeps everything out, only lets in selective molecules from the bloodstream into the brain, itself. But what happens is you end up with injury to the brain and a change in the integrity of this blood-brain barrier. So now, as a result, things that are in the bloodstream, like for instance, inflammatory molecules in the bloodstream, depending on your lifestyle, can actually get into the brain and cause neurological inflammation. Interestingly, you have within 12 hours of hitting your head, you end up with a change in the loss of barrier function in your GI tract. So now you end up with what we call a leaky gut. And this is well documented. The other thing that happens is we get significant paracervical muscle splinting and cervical joint dysfunction or subluxation. So anytime you have a head injury, you have a neck injury. And very often these neck injuries are not evaluated appropriately and not treated. And that's a big, big part of what's going on, because you can have ongoing concussion-like symptoms coming from your neck, and nobody's really looking at this. So traditionally, symptoms will dissipate after 7 to 10 days. So usually, somebody has a little, bump on the head, or, they have a fall, they hit their head, or they, are involved in a collision in a sporting game, and, they feel a little dazed, they feel a little nauseous, but, they whether they go and get it checked out or not, usually the headache, dizziness, and the whole disorientation is gone within 10 days. But up to 30% of people that have this injury, whether it be big or small, end up with persistent symptoms that last more than 10 days. And in fact, many people have symptoms that persist for years. This is what we call post-concussive syndrome, or persistent concussion symptoms. This is really what we want to focus on, is what happens to the person who has these problems and their concussion is supposedly healed. Now they have anxiety, or they have gastrointestinal issues, or chronic migraine headaches, or chronic neck pain, or anxiety, depression, for instance. All of these things become secondary to the concussion, but usually doctors are saying, well, that those things shouldn't really be now connected to the concussion because the brain usually heals pretty rapidly. So we start managing symptoms. And now what ends up happening is you end up on multiple medications to treat the symptoms, instead of really looking at, hey, could you still have a persistent issue with one of those 4 areas that I outlined already? So something to ponder. When the symptoms fade, does it mean that the brain injury is fully healed? So just because you don't have, a headache today, and this is, let's say, day 10 or day 11 after you have the concussion, is your brain healed? And the answer is usually not really. It takes a long time for the brain to remodel and heal after an injury. Just like an ankle sprain, for instance, could take, 6 or 8 weeks. We can't expect that the brain is going to be fully healed in 3 to 10 days. So here's some really, some interesting data. Here are common symptoms and signs in traumatic brain injury. And here are common symptoms and signs in depression. And really, we have all of the same things: thinking, physical, emotional, and sleep. And they're all over here in the TBI side. All those same exact things are going over here, but less physical on the depression. But almost everything across the board is the same. So my question then is, when somebody presents and they have depression, have you ever had a head injury? Because this could be secondary to head trauma. And it doesn't, and I can't even explain how many times I'm evaluating a patient and going through a case history, and we're talking about emotional health. And, they say, well, I've suffered with depression. And say, have you ever had a head trauma? And they say immediately, no, nothing significant. And I said, well, think longer. Have you ever had a head injury? Have you ever banged your head? Have you ever had a fall? I'm like, oh yeah, I did have that. I did have a concussion. I did bang my head, but it wasn't a concussion. I was in a car accident and I banged my head on the steering wheel. They said it wasn't a concussion, and after a few days I felt better. Well, something like that actually can cause problems years later, and that's what we're talking about today. So post-concussion syndrome: headaches, dizziness, chronic fatigue, irritability and mood swings, neck pain and limited movement, loss of sleep, memory loss, ringing in the ears or tinnitus, visual changes, attention and focus problems, light sensitivity, anxiety, depression, dysautonomia, and social withdrawal. That's a pretty extensive list. But when you think about it, your brain runs your entire system. You are your brain. So an injury to your brain changes every aspect of you. So here's the cerebral cortex and brainstem injury. So, this is actually a visualization on the left of the dynamic nature of the cerebral cortex. And then what you see on the right is this section in the subcortical regions, and that bottom piece that kind of sticks down into the base there is actually the brainstem. This is what the brainstem looks like, that red piece, if we were to kind of zoom up on it. And if you look up in the upper left here, you'll see that this blue area, which is connected to the upper part of the cortex, we take that out and we look at it specifically. Up in this area here, there are three sections of the brainstem. This is called the mesencephalon, this is called the pons, and this is called the medulla. And all three of these areas work together to house insane numbers of neurons and nuclei that run our internal functions. So changes here cause changes in every aspect of our physiology. This area here is called the cerebellum, and this is involved in so many functions. It used to be thought that this was just involved in motor planning and balance, and now we know that it's involved in cognition, thought, emotion, and so on. So changes in the brainstem secondary to head trauma can cause long-standing problems in the rest of your system. So the rotational forces of trauma torque and damage the midline structures of the soft brain, like wringing out a wet towel. So if you have a head injury where your head has that moment of rotation and you have traction because of the nature of the head trauma, it's like a real significant injury to this area down here in the brainstem. So the midline structures of the brain, again, brainstem, right down the middle, including the cerebellum, limbic system, basal ganglionic areas, control eye movements, balance, cardiac function, emotion, digestive function, coordinated movements, blood flow to the brain, perception of body position in space. So a lot of times when people describe, they come in and they'll say, I have headache and neck pain, and I also have lightheadedness, and I'm having a lack of focus, and I'm having chronic constipation, and just on and on and on. And immediately I say, have you ever had a head trauma? Because all of these things could be as a consequence of even a mild traumatic brain injury that wasn't really considered a concussion at the time, because there was no loss of consciousness, there was no bleeding of the head. It was dismissed by, the people that evaluated them. And now what we're dealing with is this, long-standing brain injury. Head injuries that result in concussion are often associated with an injury to the neck and spine. The associated resultant joint dysfunction may further impair brain function due to the alteration of reduced afferent input from the cervical spine. So basically what that means is that you have 7 vertebrae in your neck. They're called the cervical vertebrae, and they're connected by joints that hold them together. And usually we have a curve in the cervical spine that maintains normal joint facing and function. When you have a head injury, what ends up happening is massive splinting of these muscles in the back causes a loss of this normal curve, and then a jamming of all these joints. We call it subluxation. So now not only does it cause a jamming and this mechanical change in the joints, but it actually changes the way those joints feed information to the brain. We know that the muscle spindles, which are like the little tiny muscles between these vertebrae, have these neurological receptors called muscle spindles. And then the joint capsules themselves that hold the joints together also have massive amounts of neurological input to the brain called mechanoreceptors. And they're telling the brain all the time to stay essentially neurologically normal. So much of our sensory input comes from the neck. And when you have head trauma and neck trauma, you end up with not only neck pain, but changes in neurological function secondary to what's going on here in the abnormal cervical spine. So the big question is, why do 70% of people seem to recover from concussions and 30% don't? So post-concussive syndrome is launched by impact, but caused by the ongoing biochemical reactions within the cells and the ongoing dysfunction in the brainstem, gut, and cervical spine that nobody's looking for. That's why. If we're able to look at underlying dysfunction, we're not treating brain injury, okay? The brain injury happened already. That happened potentially months or years ago. What we're looking for is what happened in the body, what dysfunction happened in the body as a result of the brain injury. Usually these people that I see have been dismissed by their doctors already. They've already worked with the neurologist. They've already seen the concussion specialist. They've done physical therapy. They've had all of these evaluations. And now they're just searching for answers because they feel like I still have a lot of these problems related to what happened to me, but there's nothing else anybody can do. That's when we, a functional neurologist, and functional medicine, chiropractic, all of these things can play a big, big part. So this is something called a leaky brain. We've heard of a leaky gut, which is, changes in the way the lining of the intestinal system allow for protein molecules and other things to actually shift from the gut into the bloodstream. Well, the same thing happens when you have a leaky brain, and leaky brain is definitely related to concussion. So many symptoms of, the post-concussive syndrome is like brain fog, concentration, fatigue, mood shifts, low mental endurance. This is usually secondary to a leaky brain. And it's complicated by a bunch of different things like lack of sleep or sleep disruption, which is very common. Overexposure to light at night, like, looking at Instagram, at 11 o'clock at night because you're having a hard time falling asleep. That just perpetuates the problem because an overexposure to light at night changes the integration of the brain. EMF overexposure, like what we're exposed to with things like Wi-Fi and cell phones and so on, a sedentary lifestyle, lack of exercise, GI issues, all of these things all play a role in what's going on in the brain. So let's define recovery, because we always talk about, I'm recovered or I'm recovering from these injuries. So a decrease in symptoms versus a total resolution, they're two very, very different things. But unfortunately, the 1990 evaluation treatment model is still in place. I'll see people who have had a concussion, even up to a year ago, and, they're still being told, to not, especially in the beginning, total darkness. I mean, for, a week, 2 weeks, 3 weeks, no cell phones, what we want to do is we want to do active recovery. We want people to have active recovery and remediation. So this is a term called pre-morbid. What it means is what was going on in your body before you had this injury. So studies have shown that the state of your brain and emotionality before the concussion have a direct impact on how long it takes to heal. So pre-morbid chronic inflammation, GI problems, microbiome imbalances, and emotionality can actually prolong recovery. So we know that studies have been done that children with ADHD or anxiety who have a similar impact, like let's say in football, to a kid who doesn't have any of those problems, generally will have a longer recovery period because the state of the brain was different before the injury. So these are all very important things to look at. So there is a solution to this. It sounds like, oh my goodness, what am I supposed to do? I have a friend who had a concussion a year ago and they're still suffering with all these different problems, and they're getting no answers. But the first step is really to define what's wrong. Why is this person having these problems in the first place? We know that the concussion happened, but usually that's healed. It's really the secondary effects of the concussion that we need to evaluate. So functional neurology is a clinical subspecialty that addresses the interaction of the nervous system with the environment. How is the system working versus whether or not it's broken? It's not, like looking at an MRI or an EEG and saying, okay, everything looks fine. It's using detailed neurological exam and adjunctive testing to identify and reconnect or repair, changed, repair impaired neural pathways or altered neurological pathways. And this subspecialty is, MDs, DOs, DCs, all different types of doctors are using functional neurology to actively remediate this post-concussive symptoms. and or post-concussive syndrome. So here are three big things that are going on in this post-concussive region. These are the actual problems. The vestibulo-ocular region, which is like the balance system connected to your eye movements. So again, we talked about the altered VOR and the vestibular canal dysfunction. So every time I move my head, I know where my head is in space. It's one of the main things that your brain wants to know is where is my head. So if I were to close your eyes and we would have, I put a blindfold on you and we went into an elevator and I said, you're going to tell me which way we're going. And I hit the up button. You could tell me that we're going up. Or we jump in my car and I have the blindfold on you and I put it in reverse. You can tell me we're going in reverse. Or if I put you in an office chair and I spin you to the left, you can tell me that you're spinning to the left. How do you know that? You know that because of this vestibular system. You have these receptors built into your inner ear that tell you where you're going and where you're moving. And all of these things are very sensitive to motion. So head trauma impairs that function. And that's what creates this feeling of dizziness or being off balance, or even, movement issues. And we have metabolic issues like gut dysfunction, chronic GI problems and bloating and gas and can be directly related or even just an associated issue. Chronic inflammation in the body, something called oxidative stress, which is just secondary to toxicity or mitochondrial dysfunction, and a leaky blood-brain barrier and leaky gut. All of these things need to be looked at. And then obviously the big one, which is the cervicogenic one, which is, the injury to the neck that happens as a result of the head trauma that is commonly never addressed. And that is the cervical spine subluxation and what's actually going on in all of these cervical vertebrae. And what we need to do is work on restoring normal cervical spine movement, rehabilitating that neck, and actually strengthening the muscles so that they can, continue to move those joints normally. So here are some ideas about how to diagnose and treat post-concussive syndrome. Eye movements are the only physiological function that involve every part of the brain. So we can assess and evaluate what's going on in the system based on eye movements. Here's actually a journal article in the journal called Concussion with horizontal and vertical self-paced saccades as a diagnostic marker of traumatic brain injury. So saccades are fast eye movements, and we can measure these, and they're supposed to be at a certain speed as well as a certain starting and stopping distance. And you can have, all this stuff is quantifiable with different equipment. So the results indicated that using eye tracking technology to measure these metrics offer an objective, reliable, and quantifiable way of differentiating people who have had different severities of TBI and those without a TBI. So we know that, like I said before, eye movements are altered as a result of concussion. So somebody comes to me 3 months or 6 months or a year after they've had a concussion, and we can evaluate eye movements and say, this is the ongoing dysfunction. You have this neck issue, you have this gastrointestinal issue, and we need to address all of those things in order to help to get you healthy again. So here is some actual testing. This is somebody on the left, which is a normal test. These are called saccades. Saccades are these quick eye movements. The computer is able to evaluate how rapidly your eyes move and are they moving on target. You can see a beautiful straight across, boom, 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 back and forth between the two dots. This is all measured by infrared cameras in a system. On the right, this is somebody who's had post-concussive syndrome. Now, the injury was, months and months ago, and this is what they still are dealing with. So imagine that every time you move your eyes, you're driving in your car, you're out, in a crowd, your eyes are moving all the time, hundreds of thousands of times a day, but your eyes are not moving appropriately because secondary to the injury, they've been disconnected from head movements, and now this saccadic system is off. Well, the neurological strain put on your brain as a result of this dysfunction is great. And now your eyes are not moving, they're not going straight back and forth. Sometimes they're veering up or down. Sometimes they're missing the target, sometimes overshooting the target. And then we do the same thing vertically. And you can see again on the bottom left, very nice up and down movement between the two dots. And then here you can see, the right eye is actually bending out, like this up and down movement is not as appropriate. But again, several different things. You could see a significant difference from one side to the other. We also have this thing called the brain gut axis. So the physiological effects have been studied. with respect to intestinal dysfunction. And this is a big deal because I said before, we have this connection between the brain and the gut, and we have changes in the way the gut functions after head injury. So this can cause a change in the way the gastrointestinal system works, and now changes in the gut permeability or leaky gut can now alter brain function. And now you're left with this vicious cycle of ongoing symptoms neurologically secondary to ongoing gastrointestinal issues. So here is a stool test, and we look at, healthy bacteria, additional bacteria, yeast issues, again, dysbiotic bacteria, which is an overgrowth of unhealthy bacteria, yeast at the bottom, significant changes in the way we look at the microbiome, which is the colony of microbes that lives in the gut. And this is affected by, diet, stress, medication usage, and so on. But we know that this plays a big role in neurological control. And it takes much more head-body force to create a head injury than to create a neck injury. Therefore, that we can assume that every head injury creates an injury to the neck. And this was, in the Journal of the Department of Orthopedics, Dr. Letty. Based on our research, we conclude that some patients who have been told that they've suffered concussion and whose symptoms persist for several months may have actually suffered a neck injury rather than concussion or in addition to a concussion. That's why we need to have a chiropractor look at the cervical spine. Again, it may not be the only reason why you're having symptoms, but it's certainly a big reason. So this must be addressed just like all the other facets. So here's a case study, 24-year-old male, headaches. Again, usually the people who come to see me have headaches and neck pain. So while I'm going through the history, this young man also had chronic fatigue, anxiety, panic attacks, dizziness, confusion, withdrawal, and depression. So while he was at work in a crowded space, he stood up from a crouched position and hit the top of his head on a metal pipe while he was working. The impact brought him to his knees with pain and disorientation, but he continued working. He wasn't taken to the hospital. He was like, that hurt, and he hit his head. The next few days, he began to experience some confusion and trouble with memory and balance. Now, again, this is a guy who, is a big, strong guy, hit his head. After a few minutes, the pain went away. He continued working the rest of the day. Didn't go to the hospital, didn't crack his head open, didn't have any bleeding, none of these things. These issues progressed over the next 2 months, and mood changes began. He became extremely anxious and was experiencing headaches and persistent neck pain. He sought the care of 2 neurologists and a concussion specialist. They did a CAT scan. It was negative. He was ultimately told to rest in a dark room. He spent the next 6 weeks doing this as the symptoms worsened. So the 2 neurologists that evaluated him and said, he's fine, there's no injury. The concussion specialist said, yeah, you have a concussion. We just want you to rest. And he just continued to rest and rest and rest. After 8 weeks, he followed up with the second neurologist who ended up prescribing an antipsychotic medication for the mental and cognitive changes. And his family became very concerned. His whole personality had changed. After 4 months of suffering and progressively getting worse, he presented to my office for evaluation. His mom described him as a shell of his former self. He had totally withdrawn from all of his friends, broke up with his girlfriend, refused to leave the house, and when he did, he was not drive his car. He was experiencing disabling fatigue, depression, along with the headaches, dizziness, and panic attacks. He was using melatonin to fall asleep, but despite his exhaustion, could not sleep through the night. He had intermittent constipation and bloating and was taking Lexapro 20 milligrams a day with no positive change in symptoms. And he was told now, essentially, reading between the lines, now this is all in your head. Now this is anxiety and depression. Take the medication. This is not due to the concussion anymore. So clinical neurological exam when he presented, he had left-sided cerebellar dysfunction. So he had testing that was positive just on a regular neurological exam. He wasn't able to touch his finger to his nose. He had left anterior, right posterior vestibular dysfunction, which is, again, just part of an in-office clinical exam. So we're just looking at how his balance is when we're putting him on an uneven surface, and he's swaying all over the place. So we can tell that this vestibular system was involved. We had poor dual tasking when walking and counting. So he couldn't walk and count out loud at the same time without falling over and swaying to one side. Left eye failed on repeated convergence testing, just being able to bring your eyes together. You know, the first one or two he was able to do. And then as soon as he did, his left eye just failed because the neurological control in the brainstem was abnormal. Muscle testing and reflex testing was all within normal limits. So like the traditional neurological testing, you know, the muscle testing was normal, but these other subtle neurological tests that were brainstem related were definitely abnormal. He had significant cervical spine active and passive range of motion limitation, right rotation and left lateral flexion, joint dysfunction, subluxation in the upper part of his neck. So we found all of these problems in his neck. So he had all these problems in his neck, brainstem positive, you know, cranial nerve tests that revealed brainstem dysfunction. Again, neurologically, from the neurologist perspective, he was fine. He had a normal MRI, his EEG was normal, and you know, they're not looking at these soft signs. Clinical laboratory, he had gut dysbiosis, bacterial and fungal. He had an elevated high sensitivity CRP, which is, you know, elevation in, you know, chronic inflammatory markers as well as this ESR. And then when we looked at these eye movements, he had poor saccades in horizontal and vertical planes, which are those fast eye movements. And he had something called saccadic intrusions bilaterally in horizontal pursuits, which means his slow eye movements were not able to track appropriately. So he would start moving slowly and then he would jump rapidly to the next target because he was just trying to catch up, like catch-up saccades, they call them. So again, all, you know, a normal structure of his brain, didn't have a brain bleed, didn't have any, you know, any kind of black and blue on his brain, anything like that. Everything looked normal. He didn't have any structural damage. But what was left months later was some underlying weakness in the way the system works. Again, I want to really be clear because an acute concussion needs to be evaluated in a hospital. And I do not want people coming to my office if they have an acute concussion. I don't want anybody coming to my office when they have a head injury in a car accident or just come off a football field after smashing their head. You go to the emergency room, you follow up with a neurologist. And the 30% of people who go through that whole protocol who don't get better, those are the people who present to me. So program of care progressed weekly over 3 months of brain biochemical and cervical spine remediation, put him on a nutrition plan, anti-inflammatory supplements. We addressed his gut dysbiosis. We started working on head movements and eye tracking in the office, started giving him a home exercise program to do to remediate the differences in eye movements. So like an eye exercise program and specific adjustments to his neck and his upper back. And the patient returned to work after 4 weeks of care and was free of all headaches, neck pain, anxiety, and depression within 12 weeks. So again, when you look for the cause of the symptoms, instead of treating the symptoms, the patient gets better. So in closing, treating people with post-concussive symptoms is a specialty, and the functional neurologist is most qualified in this case. However, if your doctor claims to be a specialist and not told you the information I've shared here, they're not current and you should be looking for another provider. It's important to work with a collaborative team. I work with neurologists and orthopedists and psychologists to make sure that the patient gets every aspect of care. I play my role, and that's remediating these dysfunctions. I do not treat concussion, just to beat a dead horse. Again, my name is Michael Gruttadauria. I'm a chiropractic neurologist in Huntington, New York, and I hope you enjoyed this presentation.